OK，大家好啊嚇，咁今日咧就我咧就chair 呢個 section 咧就係Dr. God 咧就會講一個 presentation 嘅，咁咧佢個 presentation 咧就會用英文嘅，咁咧但係咧我就會用中文去介紹佢啦。咁Dr. God 咧係香港大學護理學院嘅助理教授，咁同時咧都係香港嘅註冊護士啦，同埋一個認證嘅瑜伽教練。咁佢係柏金遜基金會理事會成員、教育同埋培訓委員會嘅委員。佢嘅研究重點咧就係響慢性病嘅護理啦、老年病學、心理健康同埋行為健康等等嘅。咁尤其是咧係柏金遜病嘅一啲嘅護理嘅狀況。咁佢依家做緊嘅項目咧，研究項目咧就包括一啲正念技術啦，同埋一啲嘅正念瑜伽對柏金遜患者嘅影響同埋機制嘅。咁Dr. God咧就攞咗好多獎啦，咁尤其是喺2021同埋2018咧就得到咗國際行為醫學會嘅傑出研究員獎啦，同埋Early Career Award 嘅，咁仲有就係一個優秀嘅科學論文獎等等啊。好啦，我都唔阻大家時間啦，咁我哋首先咧就聽Dr. God 去講關於柏金遜症正念同埋認知行為療法嘅個演講先。Dr. God, please.
Good morning, everyone. I'm Dr. Jojo Kwok from the School of Nursing, the University of Hong Kong. I would like to extend my sincere gratitude to the Hong Kong Parkinson's Disease Foundation for inviting me to share the rules and also the strategy for using mindfulness and cognitive behavioral therapy in Parkinson's disease. When we talk about Parkinson's disease, what comes to your mind? Maybe a very stereotyped impression of a patient with resting tremor, rigidity, bradykinesia, and postural instability. As the second most common neurodegenerative disease, Parkinson's disease is typically treated as a movement disorder. Yet, physical symptoms alone may not be sufficient to capture the lived experience of patients. Most of us are familiar with the motor manifestations as presented here, including the mask-like face, the impaired fine motor skills, vocal symptoms, rigidity, etc. But not to neglect, almost every patient experiences certain degree of non-motor symptoms. Almost half of them experience neuropsychiatric problems such as anxiety, depression, and apathy. Cognitive impairment is also common along the disease progression with reduced attention and executive function, and also autonomic dysfunction such as constipation, fatigue, insomnia, excessive daytime sleepiness, and rapid eye movement sleep disorder. Along the disease progression, patients might require more and more assistance in their everyday life. Icebergs are large pieces of ice found floating in the open ocean. And looking at the Parkinson's disease iceberg, we can see motor and non-motor symptoms. However, what we are seeing from the surface is not the full picture. Most of the iceberg is hidden below the water and stay invisible. Patients and caregivers may experience profound physical, psychosocial, and spiritual distress and burden, compromising their well-being. The experience of living with PD can be stigmatizing. The day-to-day fluctuations and changes brought by disease could be difficult for the patient to cope with, and it's not easy for others to understand and have shared feelings. And the current medical and allied health service for Parkinson's disease prioritize motor symptoms management and functional rehabilitation, which provide inadequate psycho-spiritual support to deal with those psychological distress experienced by patients. Indeed, stress management is vital in Parkinson's disease. Empirical evidence indicates that PD patients are very sensitive to the effect of psychological stress. 40 to 50% of them experience stress-related neuropsychiatric symptoms, in which anxiety and anxiety depression are the prominent psychopathological phenotypes. And stress exacerbates many motor symptoms. Animal studies elucidate how chronic stress in PD patients may lead to higher susceptibility for depressive and anxiety disorders, as well as more rapid disease progression. Chronic stress elevates the stress hormone glucocortisols. It reduces the expression of brain-derived neurotrophic factors and inhibits the HPA axis, in turn further increasing the stress hormones and the risk of developing anxiety and depressive symptoms and disorders. On the other hand, the elevated stress hormones also increase pro-inflammatory agents, which may accelerate neurodegeneration and resulting in more rapid PD progression. To break this vicious cycle of chronic stress, effective stress management is crucial to elevate the PD trajectory. Here are some common treatments for anxiety and depression management. First, psychotherapy, a variety of cognitive behavioral techniques to change the negative thinking, belief, or behaviors. Second, lifestyle medicine. For example, complementary therapies such as mindfulness meditation and mind body exercise for stress management. Third, medication. If there's organic cause or the anxiety or depressive conditions are very severe, prescriptions of antidepressant, mood stabilizers, or antipsychotic pills may be needed. Last, patients with treatment-resistant conditions may need brain stimulation such as electroconvulsive therapy. And today, we are going to look into why and how we could integrate mindfulness and cognitive behavioral techniques for stress management into our daily clinical practice. Here is a recent review include 7 studies with 191 PD patients and conclude that cognitive behavioral therapy is effective in relieving depression and anxiety in PD. It also urged medical and allied health professionals to apply cognitive behavioral therapy into daily routine care for patients with Parkinson's disease. Another recent survey interviewed 5,000 PD patients and find that stress was associated with increased rumination, lower quality of life, lower self-compassion, and lower mindfulness level. Patients also indicate that stress significantly worsens both motor symptoms, especially tremor and non-motor symptoms. The findings support the application of mindfulness interventions for stress reduction. There is another neuroimaging study revealed possible cerebral mechanism involved in acute and chronic stress and the impact of mindfulness-based intervention on these networks. In Figure B, we see that mindfulness practitioners showed reduced stress correlate with great matter density, decrease in the amygdala, but increase in the hippocampus. In addition, mindfulness-based intervention studies consistently showed increased activity and structural change in insular, anterior, and posterior cingulate cortex, the striatum, and the medial and dorsolateral prefrontal cortex. All of these regions have important roles in attentional control, emotional regulation, and self-awareness. Few years before, we have pioneered the mindfulness yoga as an effective coping strategy for PD patients. The findings have been published in JAMA Neurology, and this study concluded that, compared with conventional stretching exercise, mindfulness yoga showed comparable benefits related to motor symptoms and mobility, yet with additional benefits on psychological distress, spiritual resilience, and health-related quality of life for people living with PD. In other words, mind body exercise approach may demonstrate benefits beyond the functional rehabilitation, but also psychospiritual support to enhance the holistic wellness for PD patients. So, what is cognitive behavioral therapy, CBT? CBT is a type of talk therapy focusing on the relation between thought, emotions, and behavior. Cognitions are our thoughts. What we think affects how we feel and act. Emotions are our feelings. What we feel affects how we feel and act. And behaviors are our actions. What we do affects how we feel and act. CBT highlights how negative thought can lead to negative feelings and action. But if you reframe your thought in a more positive way, it can lead to more positive feelings and helpful behaviors. To better illustrate the CBT context, we can use the half-glass metaphor. What do you think when you see this glass of water? Is your glass half full or half empty? Here is a scenario. Try to imagine you are walking down the road and you see someone you know. They recognize you, but they walk on by without saying anything. What are your feelings and thoughts? Think about it. Let's look into the relatively negative, or let's say the glass half empty response. Their thought might be, they ignored me, they don't like me, they may feel sad, low, or rejected, and they go home and avoid people. This can become a vicious circle. The more negative your thought, the more depressed you might become, and the more depressed you are, the easier it is to believe quite unrealistic and depressing things. Here is the more helpful and the glass half full response. You may think that, oh, they look a bit distracted. I wonder if there's something wrong. And you may feel concerned for them. Your action and behavior might be. Get in touch to make sure that they are okay. So in this scenario, we look at the ways we interpret events and experience and how our thoughts and interpretations can influence our emotional reactions, physical sensations, and behavior. We can see different people interpret the same event differently, depending on our mood or what has just happened before. Our interpretation is often shaped by our experience and perception. We try to make sense of the event and experience by thinking about them and giving them meaning, but we might not notice how our thoughts and interpretations being affected by our way of thinking, which play a major role in determining our reactions to those events. Along the CBT process, we are trained to notice more about the sensations, feelings, thoughts, and impulses that make up our experience. Becoming more aware of our thoughts can help us to make more sense of how we feel, how we behave, and how we react. One of the habitual patterns of thinking that many of us have is to judge our experience as being not quite right, not good enough, not what we wanted. It's very easy to get lost in those judgmental thinking patterns. We can imagine our mind like the weather and observe our mind as the observatory department. What is the weather pattern in our body and mind? What reactions to this weather do I notice? It is important to recognize thoughts are not facts. Thoughts are mental events, and emotional reactions reflect the interpretation about the situation rather than the actual situation themselves. So, what is mindfulness? Mindfulness is the energy that helps us to recognize the conditions of happiness that are already present in our lives. It's present in every moment of your daily life, but most people are forgetful. We keep on doing, but we are not really being here for most of the time. Our mind is caught in the past or in the future, caught by our worries, fear, anger, and regrets. And we are not mindful of being here and now. And mindfulness is when you are truly here and now. Mind and body together. Like the Chinese word 正念, Gam Sam, your heart is in the present, now, and here. In the Buddhist context, whenever we experience something, we experience it as one of the three ways, as either pleasant, unpleasant, or neutral. If it's something we find present, we tend to react with attachment. We want to hold on to the experience and prolong it, and have more experience like it. If it's something we find unpleasant, we tend to react with aversion. We want to stop, we want to avoid it, we try to make it go away. If it's something we find neutral, we tend to react with a lack of interest. We don't notice it, or don't care about it, or tune out and looking for something new and more exciting and interesting. The reaction of unpleasant experience with aversion will result in two arrows of suffering. The primary suffering is the unavoidable experience of the distress caused by the disease or pain itself. If we react with aversion, we may feel anger, fear, rumination, and resentment. Why is this happening to me? Why did I have Parkinson's disease? Is there any way out? You may want to push away these negative experiences, but indeed, the situations will not simply disappear. And this has caused the second era of suffering, the added distress that comes with the anger, fear, rumination, and resentment when we react with aversion to the unpleasant event. In the Buddha teaching, our relationship with the inevitable pain and distress are part of our life. And mindfulness helps us to deal with suffering more skillfully, to a more peaceful and enjoyable living. So, mindfulness in the current clinical and research context is typically described as paying attention in a particular way, on purpose in the present moment, non-judgmentally, with curiosity and kindness to the things as they are. So what is the difference between CBT and mindfulness? CBT is a thinking therapy, or let's say it's a head-based therapy, which helps you to recognize and reframe the negative thought pattern that leads to negative emotions like anxiety and depression. It's analytical in nature. The focus of CBT is on mentally pushing out and reframing those negative thoughts. And similar to CBT, mindfulness helps you to recognize the negative thoughts through a range of meditation practice. It is a feeling therapy to help you to recognize what is going on for you in the present moment, how you are thinking and feeling and experiencing things right now. And mindfulness is experiential in nature rather than analytical. The focus is on accepting thoughts as they arise and letting them go. Mindfulness is rooted within the ancient wisdom and practice, while cognitive behavioral methods were developed within modern psychology. Mindfulness and CBT might have different perspectives, but each offer specific ways to a common purpose, becoming more familiar with the mind and learning to work with it more skillfully. The combination of the two approaches has great potential to reduce the suffering and enable people to flourish and live with their life more fully. Now we have basic concept of CBT and mindfulness and how we can integrate them into our clinical practice. I'm going to share some tools with you which is easy to use. These 5 factors are important during assessment, case formulation, and intervention or treatment. First, physical. What are the client's physical conditions for better health management? What are their sleeping patterns, appetite, exercise levels? What behaviors are they displaying? Active or inactive, avoiding or confronting? Emotions. What are their emotions? Are they depressed, anxious, happy, concerned, excited? Do you notice their ability to concentrate and recall their memories? And last, what are the environmental factors such as financial, social support, and family affecting the client? After we have a basic concept of the CBT formulation, we can do something to adjust these factors to improve our client's mental and physical health. First, psychoeducation and lifestyle modification can be used to enhance the physical health and the support system. Then, diary keeping, as well as set up the goals for activity scheduling and behavioral activations. In order to have a better understanding towards our emotions and thoughts and its consequences, strategies such as labeling feelings, mindfulness, and cognitive reframing are often used. Psychoeducation is a key part of CBT, which is defined as an intervention with systematic structure and informative knowledge transfer for an illness and its treatment, integrating emotional and motivational aspects to enable patients to cope with the illness and to improve the treatment adherence and efficacy. And other tools is the activity scheduling and behavior activation. It could be particularly relevant to PD patients. Apathy, feeling of lack of interest or motivation in activities, affecting like up to 40% of PD patients, which can be frustrating for both patients and their caregivers, families, and friends. If you notice the decline in activity patterns in patients, you may invite them to use these activity scheduling and behavioral activation techniques. These techniques are based on the evidence that regularly engaging in pleasant activities may help to improve their mood, to reduce the stress, and alleviate depression and anxiety. In order to motivate them to do so, here are some tips. Here are some online resources for behavioral activation ideas and planning. You may brainstorm the behavioral activation ideas with your client. Start with setting small goals for nourishing activities, such as taking a shower and drinking a cup of tea. And motivation often follows action. It's good to keep an activity and mood loss, so you can start to see the relationship between what you do and how you feel. And last, be kind to yourself. To deal with psychological distress can be incredibly frustrating and discouraging. To show your empathy, it's so much harder to get active and enjoy things when you are in a depressed mood. And you may feel like a failure because of that. So it can take a while for your client to enjoy the activities and to feel the fun again. Another key CBT technique is cognitive reframing, to explore one's thought process in certain situations to identify negative patterns. Once you are aware of them, you can learn how to reframe these thoughts. First, to identify the thoughts that can be thought emotion. Second, to check, reflect on how accurate and useful the thought is. Third, to change the thought to a more accurate or helpful response. And diary writing is a good way of getting in touch with your own thoughts. There are lots of online resources of thought diary templates, which we could take reference of, or we could simply use our own format, write down by paper and pen, or Google or Excel sheet, based on your preference and literacy. You can write down the effects associated with different thoughts and emotions, both positive and negative, and identify potential negative patterns for change. With increased awareness, we can learn how to reframe those thoughts so they are more positive and productive. Overcoming mental health problems is a very difficult process. Repeat practice and reflection are important to foster the cognitive reframing process, and practice makes perfect. Another core skill set is mindfulness. There are different styles and forms of meditation in different cultures and religions. Since the 1990s, mindfulness meditations has been applied to multiple mental and physical health conditions and has received much attention in psychological research. Mindfulness meditation can be subdivided into methods involving focused attention and those involving open monitoring of present moment experience. You may be familiar with mindfulness-based stress reduction, integrated mind-body training, and other clinical mindfulness-based interventions such as mindfulness-based cognitive therapy, mindful self-compassion, mindful yoga therapy, etc. And the techniques include mindful breathing, sitting meditation, body scan, moving meditation, walking meditation, mindful eating, and mindful listening. So mindfulness exercise could be very simple. Our body is a powerful anchor of the attention and always here to reflect the emotions in our body and fluctuations. Through the mindful practice, you will notice these things, and all the feelings can change sometimes without the urge to do something. And when you are truly aware of your body, you can notice there is some tension and pain in your body, some stress. They may have been accumulating there for a long time, and our body suffers, but our mind is not there to help release it. In a sitting, lying, or standing position, it's always possible to release the tension. You can practice the total relaxation. Breathing in, I'm aware of my body, and breathing out, I release the tension in my body. Through this mindfulness practice, you may aware that peace is possible at the moment, and it can be practiced many times a day in the workplace, while you are driving, while you are cooking, while you are eating. And it's always possible to practice being in the present moment and to release the tension in your mind and body. So how are mindfulness and CBT techniques relate to PD management? I'm going to share some real-life example with you.
平時行路啦，唔需要好刻意，我哋就可以行到㗎。但係咧，對帕金遜症嘅患者嚟講啦，可能身體協調嗰方面咧係會差咗嘅喎。可能有時大腦傳遞俾身體嘅信息未必會做得好好啦。行下路嘅時候，突然之間咧隻腳好似啜住咗，出現咧碎步啦，又或者係疾步嘅情況，身體咧向前衝啦，呢啲都係好常見㗎。尤其是喺緊張或者係轉彎嘅時候咧，情況就更加明顯啦，亦都係好危險㗎，好大機會會跌倒啦。正念步行嘅練習咧，正正就係培養我哋對當下嗰份專注啦，對身體嘅覺察。行路嘅時候，重心轉移嘅感覺，一步一步，我哋透過行路4部曲，提起、推前、放下，重心去幫你咧重新掌握翻行路嘅節奏同埋協調。希望咧透過呢個練習，令到我哋咧行得更有自信，行得咧更加好㗎。正念步行最好嘅地方就係咧隨時隨地、隨時隨刻，我哋都可以做㗎。喺屋企啦、行街買餸啦，都係可以練習。希望你哋都可以試下感受呢個練習。
When patients experience the sudden onset of freezing of gait while crossing the road, their thought might be, "Oh my God, it comes again. I can't do this." They might be worried and fear of falling down. They might feel anxious, heart racing, chest tightness, short of breath. An untrained person might not be able to recognize and aware of these body sensation and respond. They might react with an impulse to unfreeze themselves as soon as possible and ignoring all the mental and physical disequilibrium. Stress might intensify the freezing symptoms. They might not be able to unfreeze at once. With the forward moving momentum of the body, fall is often the consequences. And here is how mindfulness and CBT can help. When a patient is trained with mindfulness techniques, their increased awareness in body sensation and emotion might help them to calm down. They might be able to stop the impulsive behavior and identify appropriate strategy to deal with the situation. And for example, applying the mindful walking techniques to stay focused and regain the calmness and to reboot their body. Isn't it wonderful? Let's have a taste together.
當我哋靜靜咁靜躺喺大地之上，用我哋嘅手心咧，輕輕嘅打開，讓我哋嘅胸懷同肩膊咧都隨隨放開，容許我哋保持端正同端莊嘅身體。兩個腳踭同腿部咧，輕輕咁喺身體嘅兩旁，1尺到1.5尺度都係舒適嘅位置嚟㗎。嗱，留意我哋嘅下巴少少內收，俾我哋嘅前額同埋下巴咧差唔多一條直線咁。而家請保持你嘅呼吸，一吸一呼，慢慢嘅吸入，慢慢嘅呼出，緩緩嘅吸入，唔需要好大聲，聲音你自己聽到就夠啦。緩緩嘅呼出。好，而家請將你嘅呼吸嘅感覺咧，由你嘅鼻端送到去胸懷，緩緩嘅呼出。再次將你呼吸嘅感覺送到去身體嘅最遠端，送到你嘅腳趾尖，緩緩嘅呼出。Namaste。
So we have a brief practice, and if you think I would like to experience more, please feel free to visit our webpage. We have prepared a webpage offering a range of guided mindfulness and yoga practice for patients with Parkinson's disease. Of course, if you don't have Parkinson's disease, you can still practice it, and it would be good for your overall well-being. Let's have a look. The web page is also smartphone friendly so that our patient can practice anywhere and anytime. And there is a brief introduction of what is mindfulness yoga, what is the feedback from our participants. You can see it's very encouraging, which help them to improve their function, their physique, and also their confidence. And then you can see here is some guide mindfulness yoga practice. You can choose what you would like to practice, okay? And if you're interested, just scan this QR code or just visit our webpage on yoga.nursing.hku.hk. And with the promising effects of mindfulness for PD rehab, we have secured 2 fundings from the Research Grants Council. We are now conducting 2 clinical trials, one aimed to examine the effects of individual mindfulness techniques for PD patients with the use of stress and inflammatory biomarkers, and another one aimed to adopt a cognitive and mindful approach to manage the freezing of gait problems in PD patients. I would like to take this opportunity to encourage you to refer any of your clients or friends or yourself to participate in our clinical trials to better manage the symptoms, as well as to contribute to the advancement of behavioral medicine for Parkinson's disease. Last but not least, we are going to launch our first mindfulness yoga teacher training in July. We welcome all allied health professionals to participate. If you are interested, you may visit the Hong Kong Youth Centre on Behavioural Health webpage, cbh.hku.hk. May all of you be well and happy. Namaste. And let's stay in touch on Twitter or email and see you all around. Thank you.
OK， 唔該晒 Dr. 哥。咁咧thank you Dr. 哥。咁嗱，我哋咧就啱啱聽完Dr. 哥嘅 presentation 啦。咁雖然 Dr. 哥話喺個 Apps 裏邊咧都有解釋乜嘢係 mindfulness， 但係我見咧就有啲朋友咧就真係好想問下呢一刻，究竟個 mindfulness 嗰個 definition 係點咧？咁亦都有觀眾問咧，佢嗰個effect 可唔可以 long last 咧？咁請阿 Dr. 可以同我哋講下。
好 ，thank you，大家好，係啦，咁都好多謝大家即係一齊聽呢個關於正念啦，拍友嘅應用啦。咁其實咧，我哋聽正念好似喎，但係咧其實咧正念咧係講嘅一種狀態咧係你個人咧係好覺察當下㗎，而咧個心咧係唔批判㗎。譬如啦，我舉個例啦，我手震嘅時候。我感受呢個震，平時咧可能我一手震咧，我會好緊張㗎，我都好介意人哋咧點樣睇我手震呢個情況。咁但係咧，正念，你將呢一個正面嘅技巧咧融入喺生活，原來你會發覺咧，你透過一吸一呼，你可以咧慢慢去感受你身體嘅感覺，感受你思想流過嘅感覺。從而咧，慢慢咧，更加咧係唔批判啦，同埋咧更加開放咁去接受呢啲感覺㗎。當你個人定落嚟嘅時候咧，可能呢個震咧，一方面冇咁影響你啦，另一方面咧都會慢慢咧去舒緩嘅。咁咧呢個就係一個正念嘅效果啦。簡單啲嚟講咧，正念其實係一個或者錯嘅心態，而係一種更加開放、更加客觀、清楚自己想法同埋情緒嘅技巧。當我哋更明白自己諗緊啲乜嘢嘅時候咧，我哋就唔會好衝動去做出一啲行為，咁從而咧令到我哋咧更好咁樣去咧同柏金遜症一齊咧去一齊生活落去㗎。咁呢個技巧會唔會係 long lasting 㗎啦？我相信都係好多研究顯示都係冇㗎。當你咧慢慢掌握呢個技巧，持之以恆嘅練習，佢唔係淨係幫你喺症狀管理方面啦，係喺你成個人生啦、你嘅態度各方面都係會有一個影響嘅。
唔該晒，多得哥。咁咧，我啱啱又收到另外一個問題咧，就係、有朋友問咧，就點樣去 assess 嗰、個mindfulness 嗰個 effect 啦，係啦，咁係啦，咁啊，多得哥可唔可以再回應一下咧？
咁我哋咧以我哋嘅經驗，我哋之前做過一啲係關於正念瑜伽嘅，又或者係一啲正念冥想嘅研究啦，係朋友啦。咁其實的確㗎，我哋要啦，好咁樣去呢個正念嘅訓練咧，係要你咧係有一個覺察力嘅，係啦。咁如果你話可能好差有啦，可能佢真係神智可能唔係咁好，但係我哋可以由簡單嘅練習咧開始去做，譬如係一啲呼吸技巧嘅練習啦，一啲咧之前嘅啦，咁樣去睇。咁睇下個結果，即係睇下個成效喺邊咧。我哋又要睇下我哋想睇邊一方面喎。如果我哋想話透過一啲可以用一啲問卷啦去問下佢哋關於佢哋咧入邊情緒嘅狀態咯。另一方面咧，可能咧我哋頭先講過，我哋都有啲研究做緊，我哋都會咧為朋友咧抽血啦，去睇下啲炎症因子同埋荷爾蒙嘅水平㗎。咁同時咧，再去睇埋咧一啲運動症狀面啊，睇下會唔會咧嗰個焦慮啊情緒都會影響我哋嘅運動症狀㗎喎。咁我哋有好多方法可以睇到嘅。
即係話用啲心理嘅指標或者一啲生理嘅指標去睇嗰個效果啦。咁你都有人問啦，究竟即係響特別，尤其是響 PD 嘅 population 咧，係咪已經有一啲 evidence 喺度咧？
有㗎，咁喺臨床上面啦，咁我哋其實喺19年發表咗一個係正念瑜伽嘅報告啦。咁我哋就將正念瑜伽咧同普通伸展同阻力訓練課程咧去做一個比較啦。我哋會見到咧兩種技巧，一個咧就齋運動，一個咧就係一個有一個正念嘅運動，我哋用瑜伽嘅方式啦。其實兩組佢哋喺身體功能都係有進步嘅喎，但係好得意嘅係啦，我哋咧發現咧喺正念瑜伽嗰組嘅參加者咧，喺佢嗰個緊張啦、焦慮、抑鬱情緒同埋咧生活質素嗰方面咧，先有一個顯著嘅進步㗎。咁所以我哋咧都鼓勵咧我哋嘅朋友啦，喺做運動嘅時候，同時咧用一啲心理嘅技巧咧，去令到自己咧好好照顧翻自己嘅心靈。係。
OK，咁咧嗱，我有一個我自己嘅問題，咁咧因為我都知道多得哥就係都有係做一啲瑜伽啦，即係為啲朋友，咁都係將 mindfulness 結合咗瑜伽去做啦。咁我就好想問下咧，因為普通嘅人咧都會做瑜伽嘅呢一個活動嘅，咁我想問咧，當我哋朋友去做瑜伽同埋普通人做瑜伽，咁究竟朋友咧要特別留意啲乜嘢咧？
係好多謝呢個問題都好重要。好多時我哋一講起瑜伽咧，好多人就會諗，哇係咪倒立啊？個頭喺地下，腳去咗天花板，咁就會好緊張啦，覺得自己做唔到喎。咁好多朋友一開始都咁講㗎。但係隨住一個過程咧，其實咧係可以我哋會見到，我哋比朋友嘅瑜伽，我哋會咧更加着重安全㗎。咁點樣可以咧加強呢個元素啦？除咗透過動作嘅設計啦，係有啲動作咧係特別咧，我哋課程咧係要循序漸進嘅。每一步唔係即係要做到10式，我哋咧其實前邊咧係有100式嘅技巧咧，我哋要做咗先㗎。咁慢慢逐步咧去令到拍友嘅平衡、身體嗰個協調改善咗，然後咧慢慢先掌握一啲咧瑜伽嘅式子嘅流動㗎。咁一個好處係咩咧？因為大家都知瑜伽咧就係比較喺地下，我哋喺張席度做啦。咁其實咧都相對地係比較安全㗎。我哋會建議咧朋友咧擺一張穩陣嘅凳啦。唔穩如果本身平衡差嘅朋友咧，我哋會建議咧佢喺埲牆嘅隔離嗰度做咯。咁當你咧有唔平衡嘅時候啦，其實隨時咧都係可以停低㗎，停一停先。我哋咧重新掌握身體嘅節奏，係啦，咁唔需要去勉強，每日自己個狀況，藥效開關都唔
同㗎。咁所以咧，你講嘅個狀況去到邊，我哋講緊係由一啲動作嘅時候，更加了解自己身體嘅能力感受，從而咧好好照顧自己嗰個需要。
係啦，咁我聽到最重要嘅就係安全啦，同埋循序漸進啦。咁其實做咩都係嘅，咁亦都可以即係慢慢等自己可以慢慢掌握咗少少技巧，再去慢慢去進步。咁呢個亦都可以避免頭先多德哥喺個講座裏邊咧，佢講過一個雙重嘅，唔係兩支箭嘅，咁大家記唔記得？有一個雙重嘅一個壓力啦嚇。即係唔單止係嗰個因為嗰個症狀啦，亦都係因為自己有啲嘢唔受控制，而去有一個雙重嘅壓力出咗嚟㗎。咁慢慢去做，即係逐啲掌握，我相信咧都係一個好好嘅一個方法嚟嘅。好啦，咁呢度咧，我哋就好多謝多德哥同我哋分享啦。咁亦都提一提柏友啦，如果有興趣咧，亦都可以上去頭先多德哥介紹嘅一啲嘅 website 啦，對一啲嘅 apps 啦，咁去睇下適唔適合自己嘅。唔該晒，多謝。
多謝。